To check in with Dr. Maukesh Basdeo to just talk about the ending of the state of emergency. It should have come to an end the end of this month, but the government has decided it's going to the parliament tomorrow to bring the state of emergency to an end. The opposition is saying maybe it's because an election is coming up why it's doing this. And of course, the government is saying it has served its purpose. But let's find out how we think that's going to affect the COVID-19 numbers. Good morning to you, Dr. Basdeo.
Good morning, Natalee. Good morning to your viewers.
Thank you so much for joining us. So, Doc, where are you on the issue? Should we have ended the state of emergency at this time?
Well, the announcement by the Prime Minister on Saturday took me by surprise with the decision to bring it to an end 2 weeks before the official date on the 29th of November. But the government's position was that it had served its purpose. And primarily the purpose was designed to have an impact on the pandemic and the spread of the infection. So wait tomorrow's debate in the Parliament. I think the Minister of Health and the Prime Minister will be able to actually lay on the table reasons as to why the decision to bring it to a premature end 2 weeks before the expiration date.
Yeah, but I mean, the fact that it was in place and we started seeing those numbers going up once we started rolling back measures and reopening the economy, obviously it really didn't serve any purpose at this time.
Correct, and you're correct at that point that if we had to separate the health issue with the economic issue was one that was high on the agenda, I think, for the removal of the suspension of the COVID-19 the state of emergency. A lot of concerns were raised in the business community as to the impact of the state of emergency and its measures. So I think it is more of a balancing, talk to balance it. But the recent spike in the infection cases will leave a lot to be discussed, whether there is a balance that can be forged between the economic needs of the country together with what we call the rise in infection rate.
Yeah, and I think ever since we started treating with this pandemic, that has always been the game that we had to play, or what we had to deal with, which was balancing lives with livelihood, and for the government balancing the health circumstances with the economic circumstances. And we're seeing that countries across the world have decided that at some point we're going to have to learn to survive with this, that we can't keep locking down, because locking down doesn't change the fact that there's a pandemic. What it does is just suppress the ability for the virus to spread. So now that we started reopening, we're seeing the numbers going up. But with the curfew out of place after the debate tomorrow and the SOE end, don't you believe this will also, give the virus the opportunity to spread even more?
It will provide an opportunity to have more people out in the public space, interact with one another. But I think the other is the onus. I think the government's policy, from how I'm looking at it, the government is putting the onus on the individual citizen. And that has come against what the medical experts have been bringing into the public domain, and that is the decline in the vaccination rate over the last month or more. So what is going to happen is that you're going to have the mixing in the public space of both the vaccinated and non-vaccinated. And if the data that is coming into the public domain is showing that the largest percentage of persons in ICU, in the hospitals, and who are infected are somewhere in the 90 to 93% are those who are unvaccinated. So it becomes rather the responsibility now falls on the citizens to take the vaccine, which will basically be an ease on the infectious rate.
Yeah, well, definitely, because I mean, you can't dispute 93% for those who are unvaccinated. But you raised an interesting point about those who are vaccinated and unvaccinated. Since day one, we've had to mix in the same society. Do the safe zones make sense when you think of the fact that, okay, so for a safe zone, you can operate here, you're able to do this, you're able to go without your mask, do what you have to do. But when you step outside of that, every other place you go is that you have to be mixing with everybody else.
That's it, because the safe zone is restricted to particular areas and particular business and so forth. You have, if you think about the safe zones, it may be possibly less than 10% than what we call the space that where the population actually interact with. And so unless you treat a country as an entire safe zone, which is happening in other parts of the world, in parts of Austria, I think in Austria, New Zealand, they are putting in place measures whereby unvaccinated persons are now basically confined to their homes and restrict their movement. So the question is whether we have seen a possibility of this going down. We're heading along this line. I don't know if we will take this the most serious move, but other countries within the region, for example, St. Vincent has implemented measures regarding to civil servants who can report to work as again vaccinated as again unvaccinated. And we are seeing that this issue now developing, and for Trinidad and Tobago it becomes even much more pressing. Having heard Dr. Hines making a prediction, a possible prediction of this country recording a possibility of an infectious rate of somewhere in the vicinity of 1,000 a day. Now that will become a serious indication of we have made what we call, let's say, backward steps in dealing with the spread of the pandemic.
You know, at this point, do you think the government can do much more in terms of ramping up its vaccination drive? Because I think the government has done everything to make vaccines available everywhere. We have choices, but some people are still choosing not to go out and get vaccinated. Is there anything else that can be done?
Well, the government has been appealing, or what we call using moral persuasion, as trying to move the population towards the vaccination. You're quite correct that the issue that we may have had in March of this year regarding the availability of vaccine no longer exists. The choices are available to the public, and it is how do you get the persons who are unvaccinated to take the vaccine. Whether we can legislate something to make it compulsory, other than that, it is left for the public themselves, the citizenry, to make that decision.
And you know what, Dr. Basdeo, it's amazing that when it comes on to this pandemic, I think we have seen just how important the public health regulations are. And I personally want to believe that if more of us are paying attention to those, we wouldn't be seeing the kind of numbers that we're seeing, because the lockdowns don't stop the virus. The curfew doesn't stop the virus. What really stops the virus from spreading is us adhering to those public health regulations. What is it about us you think that keeps us from just adhering to those very, very, to me, minute measures that could keep all of us safe?
Well, I think it is the adherence to the simple rules, where I think maybe persons are not serious about the full impact. I've read in the newspapers today that the Minister of Health had made a statement that there will be amendments or adjustments to the health regulations. So one expects that with the ending of the state of emergency tomorrow in the Parliament, the amended regulations would come into force if it is to treat with what we call these spikes that we are seeing, and to avoid what Dr. Hines is saying, the possibility of Trinidad recording close to 1,000 cases a day.
Yeah. And we saw, the launch of the nomination day yesterday in Tobago, and we're already hearing reports of, lack of social distancing, more people gathering than there should. So do you think that this too might add to what we're seeing in terms of the numbers going up?
It is going to have an impact, especially for us in an island like Tobago with a small population. It may have a more disastrous impact in Tobago than, let's say, Trinidad with a population of approximately 1.2 million. And the election campaign can become a major spreader in this time, because the onus will be left onto the political parties and their campaign teams as how best they balance what you call the campaign itself with public health. It will be yet to be seen how this has been, how it will be managed.
Mm-hmm. Well, I just wait to see, you know, how it's going to happen, because even last year when we had the general election, we did see the numbers go up after that. But fortunately for us, it went back down, you know, for the Christmas season. So now we have a Christmas season, we have the election, we're coming out of lockdowns, an economy that's reopening and numbers going up. Your overall assessment of all of that combined together?
Well, I think that with regard to the decision by the Prime Minister to lift the state of emergency, I think it's set against the backdrop of trying to forge that balance between trying to allow to inject some economic stimulus to ensure that the economy remains buoyant. But again, a lot will fall on the responsibility on the shoulders of the individual citizens of how they prepare and take care of their own health. Yeah.
All right, Dr. Basdeo, I want to thank you so much for speaking with us this morning. Any final words before we go?
No, that's fine.
All right, Dr. Basdeo, thank you so much. I appreciate it.